After being diagnosed with macular degeneration, many people want to know what treatments are available. In this lesson, we'll explain the treatments currently used to manage macular degeneration. Welcome to Macular School. I'm Corey, a certified low vision therapist. In this series, we explain macular degeneration and share practical strategies that help people stay independent as vision changes. Today, we're looking at the treatments used to manage macular degeneration. After someone is diagnosed with macular degeneration, one of the first questions they often ask is this: what treatments are available? People want to know whether doctors can stop the disease, reverse the damage, or protect their vision. The good news is that treatments and management strategies do exist. However, those treatments depend on which type of macular degeneration a person has. Macular degeneration is not a single condition with a single treatment. Instead, doctors approach care by identifying the type of AMD, monitoring the retina, and selecting treatments that help protect vision and slow progression. Understanding these treatment approaches can help people feel more informed and more confident about managing their eye health. The first important step in understanding treatment is recognizing that there are two main types of macular degeneration. These are dry AMD and wet AMD. Both forms affect the macula, which is the central part of the retina responsible for detailed vision. But the biological processes behind these two forms are different, and the treatments are also different. Dry macular degeneration is the most common form of the condition. Wet macular degeneration is less common, but it can cause vision changes more quickly. Because these two forms behave differently, doctors manage them in different ways. Let's begin with dry macular degeneration. Dry AMD develops gradually as small deposits called drusen accumulate beneath the retina. These deposits can interfere with the normal functioning of the retinal cells over time. Because dry macular degeneration usually progresses slowly, treatment often focuses on monitoring vision and supporting overall eye health. Regular eye examinations allow doctors to observe the retina and watch for changes in the macula. For some individuals with intermediate stages of macular degeneration, doctors may recommend AREDS supplements. AREDS refers to the Age-Related Eye Disease Study, a large clinical research study that evaluated specific vitamins and minerals. Researchers found that a particular combination of nutrients may help reduce the risk of progression in certain stages of macular degeneration. However, these supplements are not appropriate for everyone, and they should always be discussed with an eye care professional, your eye doctor, before starting them. Lifestyle habits may also support overall eye health. Doctors often encourage habits such as healthy nutrition, cardiovascular health, and avoiding smoking, all of which are associated with retinal health. Now let's talk about wet macular degeneration. Wet AMD occurs when abnormal blood vessels grow beneath the retina. These fragile vessels can leak fluid or blood into the macula. When this happens, vision may change more quickly. Because wet macular degeneration can progress more rapidly, it often requires active medical treatment. The most common treatment today involves medications designed to control the growth of these abnormal blood vessels. These treatments have helped many people slow vision loss and stabilize the condition. Early detection and prompt treatment are extremely important in managing wet macular degeneration. The most widely used treatment for wet macular degeneration is anti-VEGF therapy. VEGF stands for vascular endothelial growth factor, a protein that stimulates abnormal blood vessel growth. Anti-VEGF medications work by blocking this signal, helping to slow or stop the development of these abnormal vessels. These medications are delivered through injections into the eye by a retinal specialist. Although the idea of an eye injection may sound intimidating, the procedure is performed with numbing medication and sterile technique to minimize discomfort. Many patients receive injections on a regular schedule, depending on how their condition responds to the treatment. The goal of this therapy is to stabilize vision and prevent further damage to the macula. For many patients, these treatments have significantly improved the ability to manage wet macular degeneration. Another important part of treatment is monitoring vision for changes. One commonly used tool is the Amsler grid. The Amsler grid is a simple pattern of horizontal and vertical lines used to check for visual distortion. If the lines appear wavy, bent, or missing, this may indicate a change in the macula. Many patients use the grid at home to perform quick vision checks between medical appointments. If changes are noticed, contacting an eye care professional quickly can allow doctors to respond early and begin treatment if needed. Regular eye examinations remain one of the most important parts of managing macular degeneration. Eye specialists use imaging tools to observe the retina and detect subtle changes over time. This monitoring helps guide treatment decisions and protect vision wherever possible. Treatments for macular degeneration do exist. Dry macular degeneration is often managed through monitoring, lifestyle considerations, and in some cases, AREDS supplements. Wet macular degeneration may be treated with anti-VEGF injections that help stabilize the condition. Early detection, regular eye care, and informed treatment decisions all play an important role in protecting vision. With proper care and monitoring, many people continue to manage macular degeneration successfully and maintain their independence. The key idea to remember is this: while macular degeneration cannot currently be cured, treatments and monitoring can help manage the condition and protect vision. In other Macular School lessons, we'll explore additional strategies that help people adapt and maintain independence with vision changes. Thank you for viewing. See you on the next one.